My name is Puseleza Mokano. I'm the manager in the pre-reg and examination unit responsible for EISA. Please take note of the following. The session is 3 hours long, and please stay until the end of the session to make sure that you get all the information firsthand. We have received a number of questions, and we intend to make sure that we respond to those questions or address any concerns related to EISA. So you can make use of our Q&A function to ask the questions on Teams. You also have an option to do the same on YouTube. Towards the end of the workshop, you will be requested to complete a survey to confirm your attendance and rate the workshop. And this presentation will be made available on our website. I'm sure based on the questions, a number of you had the question on what EISA is. Why do you have to write the EISA, and who's supposed to write the EISA? So all these questions will be answered and addressed throughout this session. In terms of the program for the day, as I said, my name is Puseleza Mokano. I'm the main facilitator for the session, but with me I have two external facilitators, that's Dr. Fogarty and Dr. Johnson, that will take us through the session, as well as going through the examples of calculations and the general section. Thank you so much. Dr. Fogarty, over to you.
Good morning, everyone. Just waiting for my screen to come up. Welcome to the session this morning. I'm hoping that we can address some of the questions that have been coming through on email, and that will clarify in everybody's mind what we are referring to. So in this very busy slide, I'm going to try and explain to you what the purpose of the EISA is. It's the External Integrated Summative Assessment, and how it affects you as post-basic pharmacist assistants who are already qualified. I'm going to refer to two different qualifications. If I speak about a legacy qualification, that is probably applicable to most of you in the meeting who did the pharmacist assistant post-basic course before the occupational certificate was available. So if I talk about the legacy qualification, I'm talking about those that did their qualification through providers who were at that time called further education and training providers. There may be some of you who have registered with the skills development providers on the occupational certificate. And so they're two different. We will refer to that as the new course, and I will refer to the other one as the legacy course. Okay, so to get started, hopefully no one on this particular meeting is here as a pharmacist assistant learner basic. You should all be on this particular course, either have received your statement of results from your skills development provider to be able to write the EISA if you've done the occupational certificate, and if you did the legacy program, you are already a qualified post-basic assistant. But we will start here with the pharmacist assistant learner basic. Okay, the current occupational certificate requires pharmacist assistant learner basic to enroll with a provider, complete 6 months of training with the provider, receive a statement of results from the provider, which then gives them access to write what we refer to as the basic EISA, External Integrated Summative Assessment. Once they've received their results and they've successfully passed the EISA, they are then able to register with Pharmacy Council. The main distinction between the legacy program and the new program is on the National Qualifications Framework. Now, if you've done, let's use schooling as an example. if you've done matric at schooling level, you would have qualified on an NQF, National Qualifications Framework, level 4. The legacy qualification for the pharmacist assistant learner basic was at NQF level 3, whereas the qualification for the basic now on the occupational certificate is at NQF level 4. And so basic learners that qualified on the legacy qualification are being given the opportunity to write the EISA, not to become a post-basic learner, but to give them access to do the course. So I'm going to move on to the post-basic because that is what concerns most of you in this particular workshop. A pharmacist assistant learner post-basic, again, we have the legacy program, which is those of you that are already qualified, have been working for a number of years, are registered with council as qualified post-basic learners. And then we have some participants in the workshop that have done the occupational certificate with a skills development provider. They've received a statement of results, and they have to write the EISA to still be able to register as a qualified post-basic. Those of you that did the legacy qualification, I just want to quickly change my slide. Okay, those of you that did the legacy qualification, your qualification is at NQF level 4 on the National Qualifications Framework. And to be able to access the training or to be able to register as a learner pharmacy technician, you need to do what we call recognition of prior learning. And so council determined that by writing the post-basic EISA, that would be sufficient for you to transition from NQF level 4 into the learner pharmacy technician category to be able to register with a provider, because the pharmacy technician program is at NQF level 6. And so you can see that there's a gap between the 4 and the 6. And the EISA is basically saying to you, we will close that gap. If you write the EISA and you're successful in the EISA, we will close the gap between the NQF level 4 and then you will be able to register for the NQF level 6 course. There is no transition from the assistant post-basic level 4 onto the pharmacy technician register. You still have to register with a provider, go through the training program, write another EISA once you've completed the pharmacy technician course to then be able to register as a pharmacy technician. So all that this EISA is going to do for you as a qualified post-basic assistant on the legacy qualification at NQF level 4 is give you access to be able to register with a skills development provider as a learner pharmacy technician to be able to then train and do the course of a pharmacy technician. And only then, once you've successfully passed that course, will you be able to register with council. Once you've done the course and the pharmacy technician EISA, then you will register with Pharmacy Council as a technician at NQF level 6. Those of you that have completed the occupational certificate, your occupational certificate program is already at an NQF level 5. Okay, so if you've just gone through the program with your skills development provider, you've done the occupational certificate, you've completed your 12 months, you've successfully completed your knowledge, practical, and work experience modules, you've received your statement of results, you will write the EISA, and that will then allow you to register with council as a qualified pharmacist assistant post-basic. So I hope that that has clarified some of the confusion that may exist. A lot of questions have been received in the last week from council, but at the moment, that is the best I can explain it. So it's not about transitioning from one register to another. For those of you that have done the legacy qualification, it is about giving you access to be able to register as a learner pharmacy technician so that you can enroll with a skills development provider to do a course which is going to take 18 months. Once you've done that course, you will then have to write another EISA, the pharmacy technician EISA, and then register with council. And the main reason is because of the difference in the NQF level between the legacy course and the occupational certificate for the pharmacy technician. And then the last thing I just want to say about that is that currently there are no accredited providers for the pharmacy technician program. However, communication is being received by council from providers who are wishing to send in their material for accreditation. I'm just wondering if we should take a pause there and make sure that everybody understands, or whether we should continue.
You can continue, Dr. Fogati. We'll just look and address questions on the chat.
Okay, thank you. Right, so now I'm going to carry on with the actual workshop. So the format of the EISA examination for pharmacist assistant post-basic, and that includes both those that have done the legacy qualification as well as those who have done the occupational certificate and have received the statements of results from their provider. The exam is an open book online examination and consists of 120 multiple choice questions. There is a pass mark requirement of 50% for the exam, and we do not employ any negative marking. The exam in total is 4.5 hours. However, we have split the exam into 2 separate exam papers. 25% of the exam is calculations, and 75% is general questions. That splits into 30 multiple choice questions for calculations and 90 for general questions. The main difference is the sub-minimum requirement. So you are required to get 60% for the calculation section of the paper to pass. So if you achieve 50% overall for the exam, but you get less than 60% for your calculation section, you will not pass the exam. It's very important that you understand that regardless of your overall exam mark being a pass, if you fail the sub-minimum of either of the sections independently, you will not pass. The calculation section is 1.5 hours in total, and then the general section will be 3 hours in total. The exam content is divided into exit level outcomes, but we don't address each exit level outcome in order. The questions are randomized, if I can put it that way, and questions are drawn from all 4 sectors because we are training generalists. Okay, so those of you that did the legacy qualification, you may have trained in community and hospital pharmacy, for example. Those of you that did manufacturing and wholesale will have something else stated on your certificate. But going forward on the occupational certificate, all our pharmacy support personnel are trained as generalists. So there will be questions on all 4 sectors. So those of you that have worked in community and institutional may need to spend a little bit more time studying in terms of your manufacturing and wholesale, and vice versa. Okay, so it's important that you understand the context of the exam and the content, which is why we're having this workshop. Okay, so all the questions are related to the exit level outcomes, and they are based on your competencies that you are expected to be able to perform in each of the 4 sectors: community, institutional, manufacturing, and wholesale. There are 5 exit level outcomes for the post-basic qualification. Those of you that maybe have sat through the basic workshops will recognize ELO 1 to 4. They are very similar, but adapted to address the competencies of and the scope of practice of a post-basic assistant. And then exit level outcome 5 will be new for those of you that have done the basic EISA. So if we look at each ELO individually, ELO 1 is apply basic scientific knowledge to provide technical support in delivering pharmaceutical services. So it's quite a broad topic, and it covers everything from your legislation, code of conduct, ethical rules, as well as calculations and basic pharmaceutical sciences. Exit level outcome 2 is providing technical support for the ordering, managing, dispatch, and disposal of medicines, scheduled substances, medical supplies, and devices in compliance with good wholesaling and distribution practice and other legal requirements. Now, if you look at that ELO in comparison with the rest, you will see that the main focus of exit level outcome 2 is about stock management, ordering, managing, dispatch, disposal. So stock management and then good wholesale and distribution practice. There is a document on the SAPRA website that deals with good wholesale and distribution practice, and that is a resource that you should access to be able to prepare for this exit level outcome. Exit level outcome 3 is to provide technical support for the manufacture, packaging, repackaging of sterile and non-sterile medicines and scheduled substances in compliance with good manufacturing practice guidelines under the supervision of a pharmacist. Again, if we have to kind of summarize ELO 3 into a word, it would be manufacturing. So those of you that haven't really worked in manufacturing, there is some work that you would need to do in terms of catching up on your knowledge of the manufacturing environment. The most important distinction between the basic and the post-basic scope of practice and course content, therefore, is that in the basic, you didn't deal with sterile products, but in the post-basic, because it is part of your scope of practice, you are expected to also answer questions around sterile manufacture, packaging, and repackaging. So far, we've got basic sciences, we've got stock management, we've got manufacture of sterile and non-sterile, and then ELO 4 is about compounding. Compounding, manipulation, and preparation of non-sterile medicines and scheduled substances in compliance with standards as described in good pharmacy practice rules and good manufacturing practice guidelines under the supervision of a pharmacist. So small scale compounding, usually done in a hospital or community pharmacy environment. And then finally, exit level outcome 5 is to provide technical support to dispense prescriptions and sell Schedule 0, 1, and 2 medicines in compliance with legal requirements, including good pharmacy practice. So 5 exit level outcomes. And how do we divide that in the actual exam? Well, we've got 30% of questions is exit level outcome 1. Exit level outcome 2 is your stock management. There's about 15% of the questions come from that. Exit level outcome 3 is also 15%, and exit level outcome 4 is also 15%. So very evenly matched. But then the new exit level outcome in terms of the post-basic is exit level outcome 5. And so there's a bigger percentage of questions that come from ELO 5. We're going to now look at each exit level outcome individually so you can get an idea of what type of content is captured within each of the exit level outcomes. So for exit level outcome 1, which we said was basic sciences, you can see apply legislation. So Pharmacy Act, Medicines and Related Substances Act, those are the two primary acts, but there are extracts of other acts that you may need to be familiar with. Ethical and professional conduct, that's our code of conduct, our ethical rules, ethical principles. Also relevant to your scope of practice, so that also then a lot of questions around what is your scope of practice as a pharmacist assistant post-basic. Remembering to use the most updated legislation, which is available on the Pharmacy Council website. Those of you that are very interested and are informed will know that the scope of practice was updated. The amendment was published in 2024. So it's important that you use the most updated scope of practice. Then basic pharmaceutical terms and concepts concerning, and here's the keyword, sterile drug delivery systems. And then basic scientific principles, again, apply to sterile pharmaceutical preparations. Apply basic concepts of anatomy, physiology, pathophysiology in the context of common acute and chronic conditions. Okay. Exit level outcome 2, we said this was largely around stock and stock management. So we've got your good wholesale and distribution practice, principles concerning the management of stock, conduct ordering and management of stock, performing stock counts and determining a need for stock replenishment. So you can see that there may be some calculations involved here of minimum and maximum quantities of stock. Assess the stock holding for slow-moving, expired, discontinued, and short-dated stock. Complete documentation and records, and understand the processes and be able to quarantine expired, damaged, recalled medicines and medicines received back from patients, getting them ready for safe disposal. Then ELO 3. We said was about manufacture and both sterile and non-sterile manufacture. So complying with your current good manufacturing principles and legislative requirements, monitoring and controlling the environment and storage conditions for your materials according to standard operating procedures, selecting and implementing procedures to quarantine products, applying any legal or other special requirements, controlling and issuing materials, performing in-process checks, securing labels and discarding unused, damaged, or rejected labels, and completing all documentation and maintaining records following current GMP guidelines. Remember that all of this is still within your scope of practice. So you need to understand what your scope of practice is, what the limitations are of your scope of practice within each of these exit level outcomes. You will not be tested on concepts that are outside of your scope of practice. Exit level outcome 4 is about compounding, so complying with principles of good pharmacy practice concerning the compounding of non-sterile and sterile medicines and substances, performing calculations to determine quantities of ingredients, compounding and emulsion and suspension following instructions, generating records for each of your preparations produced, following legal and organizational policies and procedures, checking, cleaning, and sterilizing equipment, and performing housekeeping activities related to compounding. And then finally, in our largest ELO is, or your newest ELO is in terms of being able to dispense your Schedule 0, 1, and 2 medicines. There's communication. There's the preparation of prescription and dispensing prescriptions following legislation, GPP, and organizational procedures. Obtaining relevant information and history in consultation with a patient. Again, within your scope of practice as a post-basic pharmacist assistant. Providing medicines and advice according to good pharmacy practice standards. Referring a patient or prescription to the pharmacist for further management. Understanding your limitations as a post-basic assistant is important, so you need to know when you need to call the pharmacist for assistance. Maintaining relevant records following current legal requirements. Promoting basic hygiene, infection control, and healthy lifestyles. Selling Schedule 0, 1, and 2 medicines, and assisting with pharmacist-initiated therapy according to SOPs. Right, there's 3 different levels of questions that we also present or we test on. Sometimes a question might just be a very straightforward knowledge and comprehension question. And when we go through the workshop, we will point out to you which questions are straightforward knowledge questions and understanding. Do you understand the concept? Do you know the definition? Those are examples of pure knowledge questions. Then there's application questions, which take the level of question just one step higher, where you will have to apply the knowledge that you have to a particular question or scenario. And then the final level of questions is the analysis, synthesis, and evaluation, where there's a little bit more thinking involved. Maybe there's information that you need to consider, 2 pieces of information that you need to consider and then put together to come up with the correct answer. So just a little bit more in-depth, a little bit more thinking is required to be able to answer those questions. And you won't necessarily find those questions in your study material directly. So when you are getting ready for your exam, you need to be prepared. Okay. Sometimes people think it's an open book exam, so it's easy. I just need to arrive and write and access the material as each question comes up and I'll be fine. But that's not the case. Exam, the word exam, creates a lot of anxiety in people. And so being prepared can help reduce a lot of that anxiety. It's important to know as far as administration is concerned, when your exam is being written. What is the date of the exam? What is the time of the exam? Where am I writing the exam? Remember that this exam is a remote online assessment. So although council do provide at their facility for those of you that need to write there, many of you will write in your own space or in your own environment. So you need to make sure that the space that you find is quiet, that you won't be disturbed during that time, because the online invigilation system that we call the proctoring system will pick up any movement around you, will pick up if there's another person in the room. And so it's important that you find a space where you are isolated, that you're on your own, and you can focus and concentrate on your exam. And you need to decide where that's going to be ahead of time. And that environment also needs to have Wi-Fi access so that your and electrical access. What happens if there's a power failure, etc. Okay, so there's a lot of things that you need to consider about where you want to write your exam, or and then what resources do you need? So resources, do I need a calculator? Yes. You need pen and paper because you need to work your calculations out on pen and paper before you answer it on the online system. You also need to think about material that you need. There is online material, there is material built into the exam platform that you can access, but you need to know what that material is, what is in that material, and what material do you need that isn't included. How do you prepare? You need to, those of you I've already said, those of you that have got a lot more experience in community and hospital pharmacy, you maybe need to spend a little bit more time preparing for um, manufacture and wholesale. Which references do I need? There's a guideline that says what the prescribed references are that you should be using to help you prepare for the exam. And then most importantly, how to use the references. You need to be familiar with all of the references that you have used to prepare for the exam. You don't want to be accessing a reference for the first time when you sit down and write the exam, because that is also going to cause anxiety and stress and take up unnecessary time. For the exam itself, what do you need to bring? How does the online exam work? How long is the exam? That's what we're doing today. You will, Ms. Mohano will go through the whole online exam platform with you. If you've already written the basic EISA, then you are a step ahead because you are familiar with the process. But those of you that are doing this for the first time, it's important that you take note and that you all are required to write the practice exam. You can't write the official EISA unless you've done the practice exam, and that will also help you practice in terms of how the online exam system works. Right, some other tips. Make sure that your reference material is the latest reference material. Please, if you studied 10 years ago or longer, the material that you have from your provider at that time is probably too old. You need to use the latest reference material. Also, keep abreast of what's happening on the news. What are the current events, pandemics? What epidemics are happening? Is there an outbreak of measles somewhere or cholera? Because, of course, your examiners are also keeping notes of current events, and they may have created some questions around current events. What are other latest developments and information in the pharmaceutical space? As I said, your course notes may be irrelevant, so check if the information is still valid. Familiarize yourself with all of the reference material. Where is the index? Where will I find the topic? How to navigate around your reference material. You can't just be paging through the reference material while you're in the exam. Never use a reference that you've not used before. Also, learn from your work environment. Your work environment is required to have standard operating procedures in place. That's another resource. You can also ask for assistance from your colleagues and supervisors. Just make sure that your colleagues and supervisors are sharing the best practice with you, and that is still within legal and legislative and within your scope of practice. I'm going to hand over now to Ms. Dr. Johnson to take you through the next section.
Good morning, everyone, and welcome to today's workshop. I know that it's going to be an informative session and there's going to be lots of information provided to you. So just make sure that you are taking note of everything, and the recording will be available, so you will be able to catch up on anything that you may have missed. So far we've gone through and we've had a look at the examination as a whole. But as Dr. Fogarty had said, is that we've divided it into two sections. So it's one exam, but two sections. One section is based on calculations, and the other section is based on general practice. Now, both sections have got questions from all of the sectors of pharmacy, being manufacturing, wholesale, community, and hospital. So just so that you're aware that these questions come from a variety of areas. The overview, earlier we were speaking about percentages associated with the specific exit level outcomes, which is what the new curriculum is based upon. And this slide just helps you plan for the calculation questions. And the reason that we show you is that you can base your preparation maybe on the weighting of questions. So as you can see, we've got more questions that are coming from ELO level, exit level 4 and exit level 5, not to say that we should ignore 1, 2, and 3, but that you should balance your time accordingly. So let's have a look at what types of questions you can expect to see. And this really, we've actually structured the types of questions according to the exit level outcomes. And some of these you may have covered as part of the learner basic qualification. So make sure that you're also going back to those to make sure that you still are on top of the foundational knowledge and calculations that you would have been taught. And again, we take it one step further. So exit level outcome number 1, the types of questions that you can expect to see here are basic conversions. So what really goes off in my mind here with conversions is that you have to know your units off by heart. And later we'll talk a little bit about it being an open book, what kind of resources you can bring in. So to make sure you've got those conversion sheets with you perhaps. Then we've got dilutions, formulations, calculate an appropriate dose, and reconstitution. Then moving on to stock management, we now remember that the stock management is something that you covered in part of the basic EISA qualification, but for example, it takes it to a step above that. So you now would have done a lot more on ordering of stock because that's part of the scope of practice of a post-basic. So minimum and maximum order and reorder levels, average consumption, average monthly consumption, lead time, reconciliation calculations and stock management, as well as looking at the cost or the value of the stock. Then moving to manufacturing, packaging, and repackaging, remember that exit level outcome number 3 would really base you in the manufacturing environment. And these deal with solubility, stock consumption, master formula, reconciliation calculations in packaging operations, and expiry dates. Moving on to exit level outcome number 4, we look at compounding, manipulation, and preparation of non-sterile and sterile medicines. Okay, here we've got calculating quantities of ingredients according to that formula. So remember that master formula that becomes so important, as well as the reconciliation calculations, especially when it comes to, for example, repackaging. So you took so much out of the storeroom, you've used X amount, what are you returning or what have you used, etc. And the last one is really the new exit level outcome that we've added, which is the dispensing of prescriptions and selling of Schedule 0, 1, and 2. And a large number of calculations here are going to be based on dosage, the amount of medication that is required on a prescriptions, as well as maybe converting how many, for example, how many milligrams are in 5 mils of the solution or suspension. So this page really is so important. We're going to have a look at 1 or 2 textbooks that you might be able to use as reference material. But within those textbooks, you are going to be looking for these specific types of calculations. So let's have a look at what you can use. So there are 2 textbooks that we recommend for all types of calculations, and this is across most of the qualifications. And these are calculations for pharmaceutical practice, as well as pharmaceutical calculations. Remember that these calculation textbooks, you can't work from the beginning of the book to the end of the book because not all of those calculations are appropriate to your scope. So just be mindful of that, especially when you are having a look at those calculations. So take some time just to make sure that you are matching the previous slide where we looked at the types of calculations to the various parts or chapters within these textbooks. Within pharmaceutical practice, there is a chapter on calculations, and this is a really good overview chapter that will help you have a look at various kinds of calculations. And it's a really nice to have gone through that chapter as well. So just once again, be mindful of how you are preparing. The way that you would prepare for general questions where you may want to look up an answer is not the way that you're going to be looking at preparing for calculation questions. Calculation questions, you really need to have used these reference books beforehand. So in the weeks leading up to the examination, you're going to go through multiple examples, maybe go back to the notes that were provided by the provider, go through those examples and work through them. Ask any questions if you're not getting to the correct answer, etc. In the exam, though, you won't have enough time to be looking up all of the information. And especially when it comes to maybe looking at a new type of calculation, in those instances, it may be better to skip over those questions and then come back to them at the end. Okay, so just be mindful about using textbooks and making sure that you have really used them well in advance and that you are familiar with all of these questions. Just one last note on sometimes the way that we practice calculations is that, especially in a textbook, we've got questions that follow one another, are very similar. So, for example, C1V1 equals C2V2, you'll have 3 or 4 of those questions that may follow one another. In this exam, that's not likely to happen. You would have, for example, a question that comes from manufacturing, and then the next question that pops up is one relating to compounding, and then you have one relating to dispensing, because the questions are randomized. So it's quite useful sometimes to not always do it in a specific way that the textbook would present these questions, so that you don't expect what is coming next, but rather that you are looking at the question, having a look at the words that are popping up that tells you it's a dilution or tells you it's a conversion or a dosage calculation. So just be aware of that. That you're not trying to learn the calculations off by heart, but you really are looking at the types of formula that you can apply, how you would identify within the question, what they are asking, etc. Okay, so very, very important is that you need to work with a pen and paper, making sure that you've got enough space to do the calculations, looking at your work environment and how you're going to practice it. It's very, very important that you consider the SI units. So what are the standard units? And these you need to know off by heart. These are things that you can learn. So for example, if we talk about a percentage, it is something per 100. So if it's a percentage weight per volume, it's grams per 100 moles. Comparing that to a percentage weight per weight means that I've got X number of grams per 100 grams. So you need to have learned that off by heart. You need to know that there are 1,000 milliliters in a liter, etc. Those types of things are very easy to even jot down on, for example, a formula sheet or a unit sheet, just so that you have that on hand. Using your equipment is very, very important. And these days, a lot of people are using their phones as their calculator. Now, later you're going to be explained how the exam is going to take place, and that you actually have to use your phone as a second device that is going to monitor you during the examination. So please would you make sure that you are using a calculator, and that you are using a calculator that you are familiar with. Okay, always make sure that you check the batteries beforehand, that you know the settings, especially if you're using, for example, a scientific calculator that you may have from school. Make sure that you know the settings so that it's on the correct function. And once again, paper and pens is so important. Make sure that you have that on hand. So preparing for this exam is so critical. Okay, the formulas, so as you're going through your preparation and as you're going through the textbooks, what we suggest is that you actually create like a formula sheet. and make sure that when you have transferred the formula onto this formula sheet that it is correct. So identifying and knowing the formula is very important, especially if I go back and I have a look at ELO 2, which deals a lot with stock management. Those formulas are things that you can jot down on a piece of paper. And really, you've got to remember what each of those parts of that equation stand for. When transcribing the information, so this means the question pops up onto the screen, and you are doing your calculation steps on a piece of paper next to you. Make sure that when you are transcribing a number, that you've transcribed it correctly. So, for example, if we're saying something is 54%, and then you jot it down as 45%, now automatically you would get that question wrong because you're working with the wrong starting amount. Okay, so just make sure you have 3 minutes per calculation question. So I know that earlier we said that the word examination is stressful. Now add the word calculation examination, it becomes even more stressful. But you've got to make sure that we're getting the basics right. And transferring that correct number is so important because sometimes we make mistakes, especially in stressful situations. Okay, estimate the range. So if you're thinking about something and you may be calculating a dosage for a pediatric, and suddenly out of a bottle of 50 mils, you're telling the mother to give the child 20 mils. At this stage, there should be alarm bells going off. Would you really give a child 20 mils of maybe an analgesic suspension or something? Something goes off and says, wow, I think I've made a mistake. So make sure that you are asking yourself, is the question reasonable, the amount? So double check that. And a lot of you have been within the workspace for a while or have completed your work-based learning hours by this stage. So you would have come across this. So just make sure that you're thinking practically on the day. If you have time, it's always a good idea to double check your calculation. So we've got 3 minutes. Not all calculations will take 3 minutes. Some of them, maybe the easy conversions, are going to just take a few minutes, whereas the more complex calculations may take you a little bit longer. So use your time perhaps to double check the calculation. If you are unsure, make sure that you skip that calculation and come back to it. Remember that after you've answered something on the system, you don't have the chance to come back and change your answer. So once answered, that is the answer that will be marked. Okay. So I know this sounds really, really easy. But having something like this, you can take the slide, you can print it out and have it next to you. But converting between units, often we find that this is where students are making mistakes. So are we going smaller or are we going bigger? So if we're going micrograms, for example, here is the smallest unit, and everything is different by a factor of 1,000, but you need to know that micrograms, milligrams, grams, and kilograms. And when you are converting between them, you're dividing by 1,000, or when you are timesing by 1,000. And these slides, they may seem really, really easy, especially when you are preparing. But remember, we spoke about the stressful exam conditions that sometimes make us just miss these easy points. So write this down, have it next to you, make sure that you understand and that you're thinking about what the question is asking. In the same way, we can have a look at liters, so microliters, milliliters, liters, and kiloliters. So am I dividing when I am converting from a smaller unit to a larger unit, or am I timesing as I go from a larger unit to a smaller unit? So once again, have these next to you. Make sure that you're aware. So we mainly have got units being milligrams for solids or grams, and the standard units then for liquids is liters. And then remember that a lot of times when we talk about strengths, we're talking about percentages. and that will be percentage grams per 100 milliliters, for example. So you can actually create like a nice table for yourself, and you can have in the first column, you can have percentage weight per weight, percentage weight per volume, etc. And then the next one, you say, what is my unit? It's grams per 100 milliliters. So that is there next to you throughout the exam. Just make sure that when you are looking at these examples, the types of standard units that we are using. So be aware that sometimes if you're doing past paper questions from other countries, you may come across units that we don't use. So for example, they may refer to an ounce. They may not be referring to grams. So just a word of caution in terms of doing, especially when you are practicing examples that you might find on the internet, that the SI units may be different because of their setting. So try and make sure that you're using ones that match the South African setting. Okay, so managing time, and the managing time point comes into the exam, but remember it's going to be stressful. So you make sure you've got your watch on so that you can look at the time, or that you've got, you know, where the time is on your computer so that you can reference that. But most importantly, when you are going through these examples, time yourself. Check whether you can do these examples within 3 minutes. So, so have a look, time yourself, especially when it comes to the more complicated questions. When you're doing a practice exam, the one that you do with Pharmacy Council, that will be within the time given for calculations. But when you're practicing examples in your own time, make sure that you're working towards that round about 3 minutes per question mark. Okay. And lastly, when we see results coming in and we see all of the results, we often see blank pages or blank spaces on your answer sheets. So there's no negative marking, which means that if you get a question incorrect, you don't get -0.5, you get 0 for that question. So there's no reason to leave anything blank. So just make sure that rather go back, have a look. I got close to this answer. Maybe I just made a conversion error. I think I'm going to take a good guess, a good educator guess, and I'm going to guess that this is the correct answer. So just a word of advice in terms of that. So there's no better way than to understand what is expected with questions, than to actually do a few examples. So would you please, I know that this is going to be, the link is going to be posted in the chat. There are, I think, 12 questions. I can't give you 3 minutes per question here because we're definitely going to run out of time then. So I'm going to give you about 10 minutes to do these questions. So we're going to come back at about 10:35. So it's 12 minutes. So it's 1 minute per question. And these are really average to easy questions that you're going to be going through, but just to give you examples of questions that you might come across. So try get through as many of them as you can, answer them on the Microsoft form, and then we're going to take a look at your answer as well as the model answer provided. So I'm going to disappear for a few minutes and we're going to come back at 10:35, guys. Thank you, everyone. So far, we've got 21 responses. So we're looking for a few more. So if you haven't yet, click on the link for the Microsoft form in the chat. And if you can quickly complete these calculation questions, and in 5 minutes' time, we're going to go through the answers. Few minutes to go, everyone. We are on about 65 responses, but we've got a couple of hundred people attending today. So we're hoping that we have a mad dash of questions right at the end or answers coming through. But if you haven't yet, click on the link in the chat and answer the questions. We're going to extend the time just for a few minutes. We have had more responses coming up. We're almost up to 200. So we're going to give an extra 5 minutes. It's really, really important that you complete these questions so that we can go through them. So if you haven't yet, please click on the link and complete the form. If you have, take a few minutes to breathe and maybe start thinking about those formula sheets that you're putting together, the list of conversions and formulas, etc. Thank you, everyone. So we gave an extra few minutes and we had a lot more responses. So thank you so much. And if you haven't yet responded, you can get in your last answers quickly, and we're going to take a look. Okay, so let's take a look at how you did. This gives us the question and the distribution of your answers. So how many days will the following prescription last? And it was for metformin, 850 milligrams, and it was 56, SIG 1 POBD. So taking a look at this question, you need to know how many tablets the patient is taking on a daily basis in order to determine how many days the prescription would last for. Okay, so we had a majority choosing the second option, which was 28 days. Remember that all of the answers that are given within an MCQ calculation, a lot of them are viable answers. So we really don't like students to guess the answer. And if you didn't fully read the question and understand it, the other questions then become quite viable. Okay, so yes, you're absolutely correct. You're going to be taking 1 tablet twice a day, which means that there are 2 tablets a day. A prescription for 56 tablets would be 28 days. And just quickly, just to show you, those of you that may not have got the answer correct. The question 1, BD, means twice a day. So understanding those abbreviations now that you're post-basic becomes very important because you're dealing with prescriptions. If 56 were provided, you say 56 divided by 2 and you get 28 days supply. So from here, the formula that was used was days supply equals the total quantity dispensed divided by the daily dose. Okay, remember that here within the question, it talked about the strength of the tablet being 850 milligrams, and that has no bearing on the answer at all. So that may have confused a few people. Let's go and have a look at how you answered the second question. Okay, let me just refresh my screen. Okay, so the second question, let's have a look at it in a bar form. Here we see that there's quite a distribution of answers. So patient injects 8 units of insulin. And what is the volume in milliliters that the patient needs to inject? So in each milliliter of insulin, there are 100 units. So in this question, you're going to have to do some kind of deduction. Okay, it's not a simple conversion. Let's take a look at how you may have approached this question. Let's go to question 2. So the important part was the information that we gave you, and we told you that there are 100 units per milliliter. Okay, it's normally, these pens normally hold about 3 milliliters in total, but here we gave you the number of units per milliliter. The number of units needed, which is 8, so we say 8 divided by 100, gives us an amount of 0.08 moles. If we go back, a lot of our answers centered around the looking at various formulations or maybe mistakes that you could have made in terms of the units. So all of them have got an 8 and a 0 somewhere. And as you can see, is that did confuse a few people that may have chosen options B, C, and D. So the correct answer there was option A. Let's take a look at the next question. A prescription is written as follows: prednisone 10 milligram tablets, SIG, which means give, 20 milligrams PO BID times 2 days, then 20 milligrams PO once daily for 2 days, then 10 milligrams once daily for 2 days, and then it asks how many tablets you would need for the duration. Looking at this, most of you calculated this amount as 14. So we know that the cortisone dose normally is tapered over a couple of days. So that is what we are seeing. Within the question, it was important to read or for you to note that the prednisone tablets here each contained 10 milligrams. And that's quite important because in practice, these tablets normally contain 5 milligrams of prednisone. So you may have got to the wrong answer if you were using just your practice knowledge and didn't read the question correctly. Let's take a look at the model answer. Okay, so if we look the first 2 days, second 2 days, and then the last 2 days, we have got 20 milligrams, which is 80 milligrams in total, divided by 10, which means you would have taken 8 tablets. The same thing for the for days 3 to 4, which was the second dosing period. It was 4 tablets, and then the last one was 2 tablets. So in total, we've got 8 tablets, 4 tablets, and 2 tablets. This is a really easy question. What is a little bit difficult sometimes is making sure that you understand how everything, the number of tablets and the dose that is given and the duration. So those are important to link the 20 milligrams and the 2 days, and that you're giving it twice a day, and then that drops to once a day. And then we reduce the number of tablets on the last day. So there are a few parts here which just check that you have an understanding. Okay, taking a look at the questions again and at your answers. The next one, 150 mils of a 15% solution is diluted to a total volume of 300 mils. What is the percentage strength of the final solution? Okay, so here also we have quite a distribution. And some people answered 30, then the next one was 22.5%. Some of you thought that as we double the volume that the overall strength wouldn't change, but this is not true because we're diluting it, and that's what's stated within the question. And then most of you calculated the answer at 7.5. Let's take a look at the model answer. Okay, so this is where we use this this most popular formula being C1V1 equals C2V2. Okay, and remember, what is sometimes difficult here is associating the correct concentration and volume being 1 and like C1V1, and then connecting C2 and V2. So to start off, we have 150 mils at 15%. Then we've got the new volume being 300 moles, and so we get a value of 7.5%. There are different ways of doing these calculations, and we don't dictate which way you go about the calculation as long as you're getting to the right answer. So if you've calculated it slightly differently, don't worry. Okay. The next question, if 24 grams of a medicine is mixed with 46 grams of base, what is the percentage weight per weight of the preparation? So there are a few things coming into play here. The first thing is that you've got to know what the total amount of cream is that you are preparing, because it gives you how much medication and then how much base. And then you've got to know what are the units of percentage weight per weight. Okay, and here we see we've got quite a mix of answers. We've got majority of the learners chose 34.3, which is the correct answer, but then quite a few of you got 52.2. So let's take a look at how we would have got to the right answer. Okay, so we have to calculate the total weight that we are preparing, which is our 24 grams of medicine plus our 46 grams of base, which equals 70. If we divide 24 by 70, we get an answer in grams per gram. But remember, we don't want the answer, the strength, as in grams per gram. It asks us for the percentage strength, which is grams per 100 grams. So we've got to take our answer and multiply that by 100, and that would give you 34.3 grams. I think many of you may have gone wrong in thinking that the total weight that you were preparing was 46 grams, instead of adding the amount of drug to the amount of base to give you 70 grams. So given that most of you got a value larger, my thought is that you may have gone wrong in this first step of the calculation. Okay, let's take a look at question number 6. Calculate the average monthly consumption for amlodipine 5 milligrams, and it says pack size of 28 if the stock card indicates the following usage, and it gives you usage over 6 months. Okay, so we've got majority of the students choosing option B, which was 24. And if we think back, this question relates to stock and would come from ELO 2. Okay, so it's very important that we know this formula. So average monthly consumption equals the total units issued divided by the number of months. Okay, so if we add up all of the units and we divide them by 6, we get 24 units in a month, which is our average monthly consumption. As mentioned when we went through the slides, the stock management module is really where you can add quite a few formulas, and it's an important part of your day-to-day practice. Let's take a look at question number 7. Which of the following weight in milligrams is equivalent to 2,750 micrograms? So looking at this, this is a conversion, and this would have come out of ELO 1, where we did the basic scientific principles. And knowing how to convert between micrograms and milligrams is very important. Okay, so let's take a look at the answer. Most of you, I think, would have got this one correct. The correct answer is 2.75 milligrams. Converting from milligrams to micrograms means that we divide that by 1,000. Okay, next, let's go on to a calculation or dispensing calculation. If a prescription calls for 2¼ milliliters of mixture 3 times a day, how many days will 20¼ milliliters last? Okay, so we've got a certain dose that is given, and the important part is this is given 3 times a day. Then they're saying in total you have this amount, and how many days will that last? So again, it's more about understanding the question as compared to the difficulty of the question. It's actually quite an easy question. You just have to make sure that you understand what is being asked. So here the correct answer is 3 days, and 52% of the learners got this correct. Let's take a look if you would like the answer broken down. So we've got here, we can calculate that 2¼ is equivalent to 2.25 milliliters times about 3, because we're giving it 3 times a day. We've got 6.75 milliliters used in a day. If we've got a total of 20.25 and we divide that by 6.75, it will last 3 days. If you wanted to use this and use a specific formula, days supply equals total volume divided by the daily dose. Moving back to our questions. Question number 9. The dose of medication is 125 milligrams 8 hourly. If a vial contains 2 grams of medicine, how many vials would be needed for a 10-day supply? If we think back to the kind of situation that you would find this calculation or sector, this comes from institutional, and it's very important to identify that within a 24-hour period, we would dose this 3 times. So that's maybe the tricky part a little bit, as well as within the question, we've got milligrams and grams. Let's take a look at our model answer. So 125 milligrams given 3 times a day gives us a total of 375 milligrams per day. This over 10 days gives us 3,750, which is equivalent to 3.75 grams. Remember that our vials are in grams. Now, we don't have exactly 3.75. We've got 2 grams within each vial. So we would need to round up. So we would have 1 point something vials. We can't give a part of a vial, we'd have to give a whole vial, and therefore we would give 2 vials. Okay. So a few things there to note. Moving back to our questions, number 10, we're almost done. How many milligrams ibuprofen are present in 100 ml of suspension if there are 20 milligrams of ibuprofen in each milliliter of suspension? Looking back at our ELOs, this is that last ELO that you wouldn't have had practice with as a basic assistant. So it's important that there are going to be a number of dosing calculations. I'm sure I'll connect soon to the form, but let's take a look at how to calculate this. The concentration is 20 milligrams per ml. Therefore, in 100 mls, the total ibuprofen that you have is 2,000 milligrams. So the formula here would have been concentration in milligrams per ml times by the volume, and therefore we would have then calculated the total amount of drug or medicine in the bottle. Okay, so let's just move back. Okay, just give me 1 second. Just checking if the office can access the form at the moment, or if it's just me that's having technical difficulties.
Yes, I can access the form. You want me
Would you be able
don't even
to?
have-
Yes, if you don't mind, Ms. Letzel. Thank you so much. Okay, so let's have a look at the last 2 questions. So the answer was 2, and I just want to see for question number 10, if you can just go 1 higher. 2, there were, so yes, the correct answer was 2,000 milligrams, and that was the last answer. Okay, so looking at question number 11, a prescription requires a cream containing salicylic acid, 5% weight per weight, made up to 100 grams with oily cream. How many milligrams of salicylic acid would be required to prepare 150 grams? Okay, so it's going to be a little bit difficult to switch between screens, guys. So I'm just going to take you through this. The first important part is to identify what 5% weight per weight means. So this is 5 grams per 100 grams. Okay, now we are scaling up by a factor of 1.5. So the amount that we need is now going to be 7.5 grams, which was the second option, and 453 learners got that correct. The formula that you can use here would be mass of drug is the percentage strength times by the total mass, if you wanted to take note of the formula. Looking at the last one, what is the percentage weight per weight of iodine tincture if there is 4 grams of iodine in 200 milliliters? Okay, so having a look at this, the most, once again, is that we need to make sure that we understand what percentage weight per volume is, and this is grams per 100 mils. You would then take 4, divide that by 200, and times, once again, by 100, because remember, we want a percentage strength. So the correct answer is 2% weight per volume. Okay, and approximately half of the students got that one correct. Okay, so if you got, you would need just over 7, so you would need to get 8 correct to pass, to have a 60% pass rate. So 8 out of 12 gives you a percentage of about 66%, and then 7 out of 12 would have given you something just yeah, a little bit less than that. So if you were getting about 7 or 8 of these correct, then you're on track for that 60% pass rate for the calculation section. I'm sure we're going to have a look if there are any questions regarding calculations, but just a few words of advice, guys, is that I think most of you panic when it comes to calculations. There's some weird idea that maths is the hardest thing and that you often can't do it. So one is that, like as my husband always says, it's too soon to panic. Don't panic. Read the question, look, think about what it's asking you. If you don't know, come back to the question, and always skip it out if you don't know where to start. If you're starting on a question that is slightly more difficult, remember that the next one may be absolutely okay and you would know how to do that. So skip until you find a question that you're confident to start with, and then answer that question. So don't panic. Prepare well, use your textbooks and examples effectively, and yes. Do we have any questions about the calculation questions?
Calculations team, on your side, do you have any calculations questions that we can address now?
I'm checking, just give me a moment. No, it doesn't look like there are any questions specifically pertaining to calculations right now.
Okay. Then we will take a 10-minute break. It is 11:02 now, so we should be back by 11:12. Then we'll start with the general section. It is 12 minutes after 11. Welcome back, everyone. We will now start with the general section of the workshop.
Hi, everyone. Welcome back. I know that this session is quite long and quite a lot of information, but thankfully you will have the video to refer back to. It will be available on YouTube. I'm going to now continue with the general section. Right, so this is what the blueprint looks like for ELO 1, which by now hopefully you're remembering is the basic scientific section inclusive of legislation, scope of practice, and professional conduct. 36% of the paper, the bulk of the paper, is taken up by ELO 1, 13% by ELO 2, which is your stock management, 16% manufacture, sterile and non-sterile. ELO 4 is 13% also compounding of sterile and non-sterile, and then ELO 5, your dispensing and sale of Schedule 0, 1, and 2 medicines. As far as reference material is concerned, you are permitted to use various books, which could be PDF copies or downloaded or printed, as well as online references. And I'm going to show you where to access some of the online references and ensure that the references that you are using are applicable to the South African setting and that they are the most updated references. I think we've been clear on that. Right, so what references can you use then? You can use apps such as EM Guidance. There is a app for your phone for EM Guidance. You can also access it online. The essential medicines list, the standard treatment guidelines and essential medicines list for primary health care, pediatrics and hospital, all 3 levels. Those are accessible on the Knowledge Hub. And they are downloadable in PDF format. So you can definitely access that. And then the MSD manual is the one for stock management that is also available online and downloadable free of charge. Then your Good Pharmacy Practice Manual and associated rules. I'm going to show you where to find that on the Pharmacy Council website. That goes also for the Pharmacy Act. But then for the Medicines and Related Substances Act and the South African Guide to Good Manufacturing Practice, Good Wholesale and Distribution Practice, those you need to go to the SAPRA website to get those documents for download. Again, all of that it doesn't cost you to download those PDF documents. Right, so as far as the Pharmacy Council website is concerned, hopefully this looks familiar to most of you. You don't even need to log in to access the site. So you just go to the Pharmacy Council site. This is the landing page. You don't have to log in. You can just go straight to this little icon that looks like a book. And you click on that icon, and this is the page that you will see. And you will see that it's got legislation, and then it's also got Pharmacia. And the Pharmacia is the Pharmacy Council publication that's got articles in it that are also applicable to some of the information that you require, often written in quite nice language compared to the legislation, which is much more technical. Right, so once you click then on legislation, okay, so from here, if I click on legislation, then I'm going to get this top part of the page. It will come up, you will see that it will say Act, Regulations, Rules, Board Notice, and Proposed Legislation. Under Act, if you go, you will see the Act. And then if you click on Regulations, you will see a list of regulations. Likewise, rules will give you the good pharmacy practice rules. Again, please make sure that you use the most updated versions. So, for example, the Good Pharmacy Practice Manual and associated Pharmacy Council rules. There's been several board notices published since this particular consolidated version was published. So all of these rules that are above that, you can see GPP standards for sexual and reproductive health, GPP amendment rules. There's another amendment rule for trading titles, rules which constitute GPP changes. So there have been other updates since the consolidated manual was published. So it's important to consider all of the documents. And then board notices. These are, for example, your Bachelor of Pharmacy graduates that are wishing to register as pharmacist assistants, restoration of the registration of pharmacist requirements. Let's look at another example. Rules relating to continuing professional development. That's also pharmacist related. Committee of Formal Inquiries findings. That's examples of some of the disciplinaries that have been held at Pharmacy Council. So you can see the different variations of documents. Focus on the Act, focus on the regulations, focus on the rules. Okay, so when you're using your reference material, as we've said before, make sure you know where is the index, where do I find the different topics. Don't open a book in the exam for the first time. Make sure you are familiar with your material. Also, don't feel like you have to use your textbook or your material for every question. Okay, more is not necessarily better. Often you will know the answer, but then you start doubting yourself. That's what multiple choice questions sometimes do, is they create an element of doubt. Don't doubt yourself. If you know what the answer is the first time, then stick with that. You don't have to go and look it up. Okay, the material is only there, or the open book is only there to confirm some things that maybe you are unsure about. Okay, so don't feel like you have to consult with your material for every single question. And then we've also warned you about using notes from your providers that is old. So if you did your course many years ago, that material is maybe old and may no longer be valid. The online references, when the office goes through the online system, they will show you what the online references are. But those ones from the Pharmacy Council website and from the SAHPRA website, you can download ahead of time. Okay, you don't want to be searching for them or downloading them during the exam. So make sure that those that you are able to download ahead of time, do that ahead of time. Right, so when you are approaching a question in the exam, make sure that you read the question carefully. And then identify the statements you are sure of. So when we say that, you will get a question, and then you will get 4 options, and only one of those options is 100% correct. We also refer to it as a single best answer. So it's the best answer. There might be another answer that could be correct, could seem to be correct, but is incorrect. So it's the single best answer. Identify the statements that you are sure of are either correct or incorrect, and that is how you can get to the correct answer. Then you can, if necessary, confirm that the statements you are unsure of, that they are definitely incorrect, or if you want to double check your correct answer, but you don't have to use your reference for every question. If you feel like you can't complete the question, then carry on, and at the end you can come back. I did see some questions in the Q&A asking, can we go back and answer questions? Yes, you can go back and answer questions. Okay, so what we try and avoid is these questions that are accept, false, not, and incorrect. We try and avoid that as examiners, but we can't always. Sometimes because of the way the question is phrased, it has to be asked as an except. So if we say all of the following are true except, then you're looking for a false answer. Okay, but generally, almost 100% of your questions will be asked in a positive way. So which of the following is true? Which of the following is correct? Which is the most appropriate? Okay, so most of the questions we ask in the positive, very few are asked in the negative. In terms of managing your time, you will have 180 minutes for 90 MCQs, which gives you approximately 2 minutes per question. As for the calculations, there is no negative marking, so don't leave anything blank. Okay, you can't give an explanation as to why you chose a specific answer. And so make sure that the answer that you choose is most close to what you think is the correct answer. Okay, so that now gives us an opportunity to go through some general example questions. The office will post this link into the chat. And again, we will give you 10 minutes to answer 10 questions. It probably won't take you as long as what the calculation questions did. So it is now 11:23. Let's give you until 11:35 to answer these questions. And I will see you back then. Okay, I see the link is up now, so please click on the link.
I'm sorry, Dr. Fogarty. For those that struggle to access the link, please scan the QR code.
Thank you. Okay, it's looking good. We've got over 500 responses already. So just another few minutes and then we will look at the responses. Okay, I think we have sufficient responses to continue. So I'm going to just bring up the questions. Okay. Right, so as people keep submitting, you will see it will keep updating. So the first question was, which of the following oral antibiotics can be given to penicillin-sensitive patients? So this is, I would say, kind of an understanding question, because it's something that you would be able to find in a textbook. EM guidance would be a good resource for this one. If you look at the options that are given, you would know that amoxicillin is a penicillin, so that one is definitely not correct. Penicillin sensitive means that they can't take penicillin because they will get an allergic reaction. Then your cephalexin is a cephalosporin, which is linked very closely to your penicillins, and so that would not be the correct option. And then clavulanic acid isn't an antibiotic per se, but it is combined with a penicillin to improve the penicillin's activity. And so the correct answer in this case is the erythromycin. Wonder, just see if it's easier to do this. Just that we can't always see the full question in this mode. Okay, so which of the following measures will be most effective to ensure that temperatures in a medicine storeroom remain favorable for storage of medicines? So fairly straightforward, also a very easy knowledge question. Painting the walls, like, oh gosh, okay, this is now not a good question. If we do statistical analysis on this question, you will find that this will not be a good question because everybody answered correctly. Okay, right. The next question, when completing a store's requisition form, what information should be filled in accurately? So for this question, there's a little bit of thinking because you need to know what a store's requisition form is. It's like an order form. You're ordering from the store, the main store. If you work in a dispensary, you're ordering from the main store. And so what needs to be on that requisition form? The only correct answer here is the unit of issue and quantity required. The average monthly consumption is maybe something you would complete on a bin card if you still work on a bin card system, but not something that you would fill in when you are requesting stock from your bulk store. And then lead time and driver delivery details are not correct. In that it's not necessary on a requisition form. The next question, which medicine type is commonly used to relieve pain? You've got to understand maybe the definitions of each of these terms. What is an analgesic? What is an antacid? What is an antihistamine? What is an antifungal? And then you need to know that an analgesic is something that is used to relieve pain. Okay, this one, it looks like it's a little bit more difficult because we've got a bit of a mix of answers. A pharmacist assistant post-basic is asked to prepare a chemotherapy infusion. Which statement is correct? So you've got to look at these statements carefully because it's the first one says this is not within the scope of practice of a pharmacist assistant post-basic. If you think of what a chemotherapy infusion is, it's a sterile product and you've been asked to prepare that. If you go back to your scope of practice, you will see that you are allowed to prepare sterile preparations. Now, it's not to say you may need additional training because, you're working with chemotherapeutics. So you may need additional training, but that it's not within your scope of practice is incorrect. So A is incorrect. That first answer is those of you that answered that that was the correct answer, you are not right, because it is within your scope of practice. You may need additional training, but it is within your scope of practice. It may be performed under the direct supervision of a pharmacist. That is correct. Permitted under indirect supervision. No, that's not correct. And you need an additional permit. You don't need an additional permit. You may just need additional training, but it is within your scope of practice. So B is the correct answer here. Okay, here's another definition. What does the term indication refer to in a patient information leaflet? How the medicine works in the body, it's a definition. So again, it's a knowledge question, knowledge and comprehension. How a medicine works in the body? No. Negative effects that arise from taking the medicine, that would be an adverse effect. The time at which the medicine should be taken, that's the frequency. So the correct answer is the main condition for which the medicine is used. Okay, so you can see that you just need to know the definition, what is an indication, and then you'll be able to select the correct answer. The next question, which of the following medicines is an example of a non-steroidal anti-inflammatory medicines? Most of you have answered this one correctly. Again, you need to know what class of agent each of these is. So your pseudoephedrine would be a decongestant. Your oxymetazoline is also a decongestant. And then your chlorpheniramine is an antihistamine. The only correct answer is aspirin. Okay, which of the following? This is an example of a negatively phrased question. Which of the following items may not be sold in a community pharmacy? You will also see that we highlight the not so that it's not lost in the question and that you can clearly see what are we looking for that cannot be sold in a pharmacy. And you are correct in that vape devices or any other tobacco-related products cannot be sold in a pharmacy unless it's for cessation of smoking. And then we have this question: which statement about a sublingual dosage form is correct? So you need to, again, understand what is a sublingual dosage form and how is it administered. The correct answer is A, it's placed under the tongue. It is dissolved in water before taking. That would be the effervescent. It's placed on the inside of the cheek. Well, that would be a buccal. And then it's swallowed whole without chewing or crushing. Those would be your slow release or modified release tablets. So the correct answer is it is placed under the tongue. And this one, if the directions on a prescription are Sig Empaped 125 milligram PR Q8H PRN, what dosage form should be dispensed? Now, most of you might have just answered suppository because you know what Empaped is. But if a example here, if we had used an example that was available in more than one dosage form, then knowing the name of the medication wouldn't be enough. You would need to know what PR stands for, and PR stands for per rectum. And so this one might have been a little bit easy because Empaped only comes in a suppository form, but if it was paracetamol, for example, and it was PR, yeah, then it would be, you would need to know that the PR is per rectum and therefore suppository is the correct answer. Right, and that brings us to the end of the general section questions. I'm now going to hand over to the office to take you through the remote online examination.
Thank you, Dr. Fogarty. I will project now. Hey, hi everyone, and thank you for staying until this part of the presentation. So we have until 12:30 to go through this and do the demo for you. So before I go into the actual presentation, I just want to highlight the most important part that all our examination, or if I may say, council conducts all the examination as remote or online. That includes the EISA. So it is important to ensure that you, as the candidate, you are prepared in terms of the preparation for your examination and you have the necessary equipment, reference materials, internet connection, and so forth. So what I'm going to cover now is everything that's related to the examination itself. So before booking the EISA, all the three categories that do qualify to write the EISA post-basic should meet a minimum eligibility criteria. So we have three groups that can take on the EISA post-basic. So we have the pharmacy assistant post-basic, registered under the new or the occupational certificate qualification. So if you are registered as a learner post-basic and occupational certificate, you must have completed a minimum of 12 months of training with an accredited provider and successfully completed the knowledge, practical, and work experience module. You must have received a statement of result from the provider, and you will need to write a practice EISA. You will have to book online for the EISA. So everyone who's registered with Pharmacy Council has the login details. So you have to log in into your profile and book for the EISA online. And then if you are registered as a qualified pharmacy assistant post-basic and you plan to enroll as a learner pharmacy technician on the new occupational certificate qualification, the requirement is that you are currently registered as a qualified pharmacy assistant on the council register and you are active. So if you are qualified but you are removed from non-payment or any other reason, you will not be able to book. So you must be active at the time of booking. You will need to complete the practice EISA and then book online and pay the applicable fee. So in the case of former BPharm students that are currently registered on our register as pharmacy assistant post-basic, the requirement is that you are appearing on the council register as a learner post-basic former BPharm student. You have already completed 400 hours in an approved pharmacy, and that should be under the direct personal supervision of a pharmacist. You have submitted at least one progress report. You completed practice EISA and booked online and paid the applicable fee. So these are the three categories with the specific eligibility criteria. So as I said, all bookings are done online. You need to log in onto the SAPC website using your P number, ID number, and your password, and you will land on the dashboard. So once you're on the dashboard, you go under the examination tab as highlighted. Then under examination, you go under examination booking. So for those that have already booked online, this step, I think you understand as it was highlighted on the communication sheet. So once you are under the booking, there's two sections as highlighted earlier for the EISA. You have the calculation and the general section. So you will need to click on each and select the venue for each. In this case, for the 1st of September, it is a practice EISA. So you just select the venue and it should be the same for both the calculation and the general section. And then instead of this amount, which is 737, you would have seen it says no fee applicable. So the only time you will pay to write the EISA if it is the EISA, not the practice. So for the upcoming EISA, then there will be a fee of 737 applicable, and there's also a late fee, which I will cover later. So you have three options to make payment. If you have a credit balance on the account, you can use that. You can use your card, or Visa or MasterCard, or you can use the SID, which will redirect you to your internet banking. So in terms of preparing for the examination, you have to make sure that you have the current cell phone number and email address on the SAPC website. So if you have changed your cell phone or email, it's important before committing to the examination that you update your contact details, because that's how we will communicate all the details related to the EISA or the examination. Also make sure that your profile picture has been updated, and I will show you how to do that on the upcoming slides. So in terms of 2026, we've already had one practice EISA that took place on the 10th of March 2026, and the next one, and that's the one that's currently open, is the 1st of September. So at the time when communication was shared, the only date that appeared was the 1st of September. But following the communication, we had so many people booking for the examination that we have gone above the maximum number of candidates allowed to write. So the decision was made that we will have two groups of people writing the upcoming practice EISA. So the first, at this point, we have 2,000 odd people that have booked to write. So if the number remains after the 24th of August, that is next week, we will have half of the people writing on the first and the other half writing on the second. So if the number, like I said, is about 2,000, the first 1,000 will write on the 1st of September, and the second half will write on the 2nd of September, but communication will be shared on who's writing when. So in terms of the actual EISA, we've had one as well, which has taken place on 21 and 22 April. So the next one will be on 6 and 7 October. So just maybe to clarify, for practice EISA, we have both sections written on the same day. However, on the actual EISA, you have 2 days. So you will write the first section on day 1, and then the second section on day 2. So when booking for the EISA, we have two openings. So we have the main opening. So in this case, will be on the 25th of August. So if you are unable, so you book between the 25th of August until the 8th of September. If you're unable to book by the time that the bookings close, we do open late bookings, and those then start on the 9th of September until the 22nd. So the difference now in terms of the early booking versus the late booking is that if you book within the first period, which is the normal bookings, the booking fee is 737. But if you miss that period, then you will have to pay a late booking fee. In this case, is 1,104. And I have to highlight again, for the practice EISA, there is no fee applicable. So there's nothing to pay for the practice. But if you intend to write the EISA, then you will have to pay the applicable. So this is the question that we got in the last 2 weeks regarding where to access the EISA documents, so the manual and the practice papers. So you don't need to log in to access all these documents or reference documents on the website. So if you log in onto the Pharmacy Council website, you go under registered persons, and then you will select learner or trainee, and then under that tab, then you go under assessment. All the practice papers are saved there, as well as the manual, but I will also show you before the end of the session. In terms of writing, as I said, we conduct a remote online examination. So you as the candidate choose which venue will best suit you to write at. So you can write from your place of residence if you have all the necessary equipment required for the examination. You can also book to write at your workplace. However, in this case, you have to communicate with your employer to ensure that you will not have any struggles to access the examination, because you with most workplaces for their own protection, they have firewalls. So in terms of the examination, you have to confirm with them that there are no firewalls that will block you from accessing the examination before you select this venue option. You can also select to write any other. So we have internet cafes, we have libraries where you can write. The only thing you have to make sure that you access all the equipment, and there's also low noise levels to be able to continue with the examination. But if all the other venue options are not suitable for you, you are more than welcome to select SAPC offices where you will be provided with a computer, mouse, charger. The only thing you have to bring is your cell phone. So in terms of remote examination, I think this has been covered, but I will reiterate, when you're writing the examination, whether you're writing from home or you're writing at your workplace, you have to make sure that the place where you're writing, it is quiet and it is suitable for you to write, and there is enough space for the computer, your cell phone, as well as the reference material. I think Dr. Fogati and Dr. Johnston have reiterated on this matter that you need to download your electronic references before the examination date. So you can download them, or you can bookmark them to make sure that on the day of the exam, then you don't struggle trying to access the documents or reference material. Ensure that you have the necessary equipment needed, such as your calculator. And then if you need to work out your calculation on a paper, you should have that to avoid now struggling during the examination. It's important to keep calm and communicate with your invigilator if you're experiencing any challenges. So I'll show you the ways to communicate with the office. But if you are logged on and you're on our examination platform, we do have a way to communicate with you as the candidate. So in terms of the device and connectivity needed for the examination, you cannot use a cell phone to write the examination. That is very, very important. So if you intend to write, you need to make sure that you have a laptop or a desktop computer to be able to write. Make sure that you have the updates, you have run your updates, and your computer is working in terms of camera as well as your it's working in terms of the camera, the microphone, and so forth. So any device that you choose to use, it must have a camera, or if it does not have a camera, it should be linked to a camera with a video capability. Connectivity is very important. A minimum to be able to write the examination should be 3G, and there's only 3 browsers that are compatible with the examination platform. So it's either Google Chrome, Firefox, or Microsoft Edge. For those that are using Apple products with Safari, you will not be able to use Safari for the examination. However, you can download these 3 browsers before you write the exam. As I said, it's important to update your profile picture before the examination. So the minimum requirements is that it should be a color image, and it should be taken in the last 6 months. It should be taken in the last 6 months, and it should be of your head and shoulders. The profile picture, the reason why we want you to make sure that you upload before the examination and that the picture is current is because that profile picture will be used then to compare yourself as the candidate on the day versus that picture. So this is just an example of how to update your profile picture. You will log in onto the SAPC website and then go to your profile, and then under the profile, you can choose a file to update the current picture that is on the website. On the day of the examination, you will have 2 options to access the examination. So before the exam, it's a day or 2 before the exam, we do share instruction on how to access the examination. So there will be a link to access the examination, or you can go to the SAPC website to access the exam. So under registered person, you can go to learner, student, or trainee, and then go to assessment. And under assessment, there will be a date for that day of the exam. So if you're writing on the 1st of September, you will see something like this, but with the date practice EISA 1 September, then you can click there to access the exam. So you can access the examination by logging in onto the SAPC profile, because this will take you to the dashboard and not to the exam platform. So it's important that you follow these instructions. So as I said, with the actual EISA, it's a 2-day examination, unlike with the practice. So the reference here is with the actual EISA, where the exam is written over 2 days. So on day one, you will need to be seated and ready to write from 8 a.m. You will log in onto the profile, and you will receive an OTP, which is normally valid for 10 minutes. And you'll enter the OTP. You'll be redirected to the declaration. You will read the rules and then wait until 9 a.m. And then as soon as we get to 9 a.m., the examination will start, and you can start the examination. The exam is invigilated through a remote proctoring system with a continuous video feeds and images being taken throughout the examination. And your invigilator will also be communicating with you should there be challenges on the same platform. And for the first day, the exam will end at 10:30. On day two, the same, you need to be seated by 8 a.m. The examination will start by 9 o'clock. The same process will apply as with first day. So you start writing at 9, but in this case, you end the examination at 12. So this is now the demonstration on how to log in and access the examination on the SAPC website. We have prepared a video, which you can also watch at your own time, but I will start the video for you to see how you can access the examination.
Welcome to SAPC's step-by-step guide on how to log in to your examination. Ms. Lisbeth Kumede, Manager in the Pre-Registration Department, will guide through the process.
For examination, you are afforded the opportunity to choose whether you're going to write at your place of residence, you're going to write at a workplace, or you're going to write at any other venue that you deem comfortable and fit enough to meet the requirements of the examination. So the SAPC then uses a system called the proctoring system for them to then be able to invigilate you throughout your examination session. So when you're writing the examination, you then require 2 devices. One, a laptop with enough network coverage to cover you throughout the examination, right? So your laptop must have a functioning webcam for us to be able to see you just the way that you are seeing me right now. So throughout your examination, SAPC is monitoring you from your webcam to be able to see what you are looking at and what your eyes are paying attention to throughout your examination. Second thing that you need is a functioning smartphone. Doesn't really matter the brand that you're using, as long as its cameras are working on the day of the exam. So before you sit for your exam, make sure that you have 2 devices: a laptop with a webcam, a smartphone with functioning camera, so that we're able to see you from the side. So while we are seeing you from the front, you using your webcam, we also need to see a side view using your smartphone. So the smartphone gives us access to see your workstation. We must be able to see what you do with your hands. We must also have a view of your surrounding throughout. Thirdly, is while you are writing, you are required to share the screen. So that means that we need to see what you are doing on the device itself. Whatever tabs we have open, SAPC needs to be able to see that. Because it's an open book exam, you can have actual paper, pen notes that you are using, and you can also have electronic copies that you are using. So while we are able to see what you have on the paper using the smartphone, you also need to share your screen so they're able to see what documents you have opened as you are progressing with the exam. So we are going to go through 2 steps right now. One is how to get through the exam, right, and what you need to do. 2 is what SAPC is then able to see as you are writing the examination. I will keep my screen shared so that you are able to see and able to follow through what you need to do on the day of either the practice exam or the actual examination. So you will need to choose one of 3 browsers that you are comfortable with for the exam. Advice: have all 3 browsers downloaded prior to the exam. The browsers are Google Chrome, Firefox, or Microsoft Edge. Have all 3 downloaded, and then you'll be able to see which one you want to use on the day and which one you can revert back to should you need to. So for this demo, I will use Google Chrome because that's the one that I usually use. No specific preference whatsoever. I will now share my screen for you to then see what I'm doing. So what you do then is we go to your preferred browser. Like I said, I'm going to go with Google Chrome, type in the SAPC website, all right? Then you go to the SAPC website. Then please ensure that you do not click on the red login button. Under normal circumstances, you come here for anything else, but for the purposes of EISA, please do not click on the red button. Instead, come here where it says registered persons. When you click on the registered persons, it will give you the different registers of people that we have. When you are on this page, you will see that after pharmacy student, there's learner, student, trainee. That is the role that you currently fall in. When you click on that one, you will see that it will give you the overview of the learner, the scope of practice of the learner, CPDs, applications, and what you are looking for is assessment. You will then click on assessment. When you get to assessment, it will give you all the information that you could possibly need for the EISA. So even right now, as you are prepping for the EISA, this is the page that you can go to. Here you will find the different EISA dates for basic, the different EISA dates for post-basic, right? Below that is all any other information that you could need in preparation for the EISA, including previous presentations. For the purpose of this particular training, when you get to assessment, please click on where it says click here for the date that aligns with the next upcoming EISA. So the next EISA is on the 4th of June, right? So you'll click where it says click here for the EISA of the 4th of June. When you click there, it will take you to a different page that will then have you inputting in your details. So you'll put in your P number, your ID number, your password, and then continue into the EISA. We then go through a validation process, after which we land on the OTP page. So the OTP is shared via both SMS and email. So whichever is easy for you to access on the day, we'll go through that. It will say there that it will receive your OTP within 10 minutes, but usually you get this within a few minutes. So I have my phone next to me. It's going to be easier for me to go to my SMSs to quickly check. And yes, I've already received my SMS, right? So you can see I have my SMS already with me. I got my SMS just now. And then what I will quickly do is put it in, and my OTP is 52806, right? And continue, and then it will take you through the steps that you need to follow. Right. The first one is it shows you that you must have proper lighting. Make sure that there are no other faces visible except for yourself. You will click next, and then it will start doing the system checks, right? So when it comes to the system checks, one, it will do a browser check. The browser check is to check that you're using a compatible browser. Remember, we said it's either Chrome, Firefox, or Microsoft Edge, right? It will do a webcam check. The webcam check is to check that your camera is on and not connected to anything else. So as you can see, my webcam check failed. Reason being, I am using it on the Teams to record this session, right? Then we'll do a microphone check to see if my microphone is open. Remember, during the examination, you must also be able to hear everything that is happening in the room that you're writing in. The next check will be your screen check to see that you have enabled sharing your screen. We need to be able to see everything that you're doing on the screen. Then it will do a network check to see if you are stable throughout your examination. So with the browser check, I've passed because I went to one of the three, which was Chrome, Edge, or Firefox. With the webcam check, I failed. The reason why I failed is because my webcam is currently used for a different platform and not the examination. So that means I need to go then to my Teams, right? And stop sharing my camera so that I can then go back and retry this check, since now my camera is no longer being utilized by Team and is now available for the system to use to prompt and during the examination. We're going to go through the check and see now I'm green. My microphone is green. They are able to hear everything that I'm doing throughout the examination, so that passed. We are now on the screen check. With the screen check, I currently have my second screen connected, which is why we are able to see screen 2. When you have 2 screens opened like this, you are unable to share all of them at the same time. So you'll be asked to, you'll be forced to choose one. But remember that we say that we must be able to see everything that you're doing. So if you have 2 screens and you're only able to share one, that technically means that you're not able to see screen 2. Right? So if I choose the first screen, which is my daily screen, and I click share, I will definitely fail this check, because now there's a second screen that is not being shared and therefore not being monitored, meaning that I couldn't do anything else on the other screen, which is not being part of the invigilation. So what I need to do is only one screen functioning throughout the examination. I will now click retry, and as you can see, my second screen is no longer connected. Therefore, I will try to share my entire screen and see if I am now able to pass through the checks. I've gone green. It's checking my network to see if currently I am stable. I've passed that. It's also going to check my web RPC, and I've also passed that. Only then will I be able to click next. So if you fail your browser, your webcam, your browser can also fail if the version that you are using is old. So make sure that you monitor any other update that your laptop might want you to do prior to the examination. Your webcam, make sure you're familiar with your settings. Test your webcam. Actually go and find your camera from the laptop and try to take a picture just to make sure that it's functioning, right? Also your microphone, just try, I don't know, call a friend via Teams via your microphone to make sure that it's working. Try and have a Teams meeting to see if you're able to share your screen. Another thing is we will send you a link, right? We will send you a link with the prompter to test all of this. Make sure that you test so that you are able to identify any problem you might have prior to the examination. When we give you the link, it will perform all of these 6 checks on the device. Make sure that you follow it through so that you can make alternative plans on time. Now that I have all my greens, I'm going to then press next. Then it's going to show me my profile to verify that it's the right person taking the examination. I do update my correct information. I will then press next. Then it's going to ask me to take a photo. So when it comes to this photo, make sure that it is a shoulder width photo. So how I am currently appearing, right? So how I'm currently appearing is a bit of my shoulders are in the photo. My whole face is in the photo. I am not too close to the camera, right? And I'm not too far back. So just make sure that you position yourself very well. Also, my lighting is tight. Right? I don't have that blurring light over my head. It's not too dark. It's just good enough for me to then do what? Take a photo. So when you're here, you then decide on whatever pose you want to strike, right? Just make sure that we're able to identify you. So you stand here, shoulders into the frame a little bit, not too much, and then you click, take photo. All right. So as you can see, they are saying that there was too much going on when it comes to my photo. There was too many things. There's poor lighting. So now I need to reposition myself and click on retry. If it's saying that there's something wrong with your picture, just click retry and then see if you can reposition yourself and click take photo. Now the system is happy with the photo that I've taken, and only then will there be a next button. Now I will click next. Now it gives you a QR code. This is where your smartphone comes in. If different devices have the QR code scanner in different parts of the device, just make sure that you are familiar with where your QR code scanner is. And if it doesn't have a QR scanner, there are many apps that you can download that will allow you to scan your QR code. Mine came with the phone, so now I'm scanning the QR code. While you are scanning the QR code, your laptop will remain on this screen and nothing will happen. The next button will remain gray. Your focus shifts from the laptop and point to your cell phone. So now focus on the video feed, so I can be able to show you what you are seeing. So as soon as you scan, you will see that on your phone, it will say there that you have scanned it, and then you will have to open the link. When I click open on the link, I'm just going to show you, it's going to ask me to then do a quick recording of my surrounding. When I press there, it's going to ask me to now start recording. I will then click on start recording. When I start recording, I then have to record my whole surrounding, right? So I will then just turn around so that with a full feed showing exactly where I am. I am showing my entire office, right? To show that there is no one sitting with me in the office. I am all by myself, right? And as you can see there, you can see what the camera is showing. So connected with the back camera. Once I have taken a full video, I will then click stop recording. It will ask me to save the recording there at the bottom. I will then click save recording. It asks if I am sure that I want to save the recording. I will say yes. I am sure. It's giving me a preview of the recording, and then it saves the recording. So now it's asking me to please wait while it saves the recording. I am just now following all the instructions from the phone. It says that now the camera has been successfully connected. I can go back to the computer, right? So as you can see, everything that is appearing from my back camera is now available. So what that means then is I need to position the phone in such a way that I am visible. So then I need to find something to balance the phone so that as I'm working, they are able to see my hands and they're able to see what I am doing. Now that we have successfully connected our phone, and you can see there that you can see me from the phone and from the recording. I will now then close the camera from the laptop so that I can go back to sharing the screen, and you can now also then be able to see what we are now doing. When I go back now, you can see that the next button is available for me to go on to the next step. Remember before, the next button was not available, right? And then once I click start again, remember I must share my screen. It's asking me to choose what I want to share. I want to share my entire screen, and then I click share. Now we need to go through the declaration. But before we go through it, I want to give you some pointers. You can see here at the bottom of the screen, that's how the invigilator is seeing me. That's the front view camera from the webcam, right? And then my cell phone is on the side also monitoring me. My screen is being shared. So at this point, my invigilator is able to see 3 screens from my end. They're able to see that I'm currently doing my declaration, and that is the only tab open. They're also able to see my front view from the webcam, and they're also able to see me from the camera that I've pointed on the side. Now, I must read through all the declaration. When you get a declaration, all of them will be unticked. You must click, they will be unticked, right? You will actually have to physically tick one of them. I've unticked 3 to show you something. When there's a declaration that is not ticked, you will not have a continue button. So what you will do is you will read through each declaration, right? And then you tick it to say that you will comply. The first one says that you're writing the examination in a suitable area with minimum anticipated distraction. This is also important when you're choosing your venue, right? The second one says that you are writing the examination at the place that you chose during the booking. If the place that you chose during your booking changes, just let SAPC know that you're not going to be writing at home, you're not writing at work, or vice versa, or you're not coming to the SAPC office, so that we know where exactly you'll be writing the examination. Next one, I am not sitting next to anyone. So here you're confirming that you will not be getting any help from anyone, right? You take it. You will not be receiving any assistance from anyone when writing the exam, and not sitting to any other intern. You take it. You will not communicate, whether it's verbally, electronically, WhatsApp group, whatever it is, with either a tutor, pharmacist, any other person who can give any assistance during the examination. You will not use any other reference except for the ones printed for the exam. Remember, in the manual, we bring list your exams in there. We go to the website, we also list your preferred references there. And then also we've already spoken about how Google can be used, but not as a reference during the examination. You will not give assistance to anyone. You will not be screen grabbing the questions during the examination or noting down the questions during the examination for you to share with anyone. And if you are aware of anyone who is recording the examination, screen grabbing, writing down, and distributing the examination, you will then share this with the SAPC. So now, once you have made sure that all of your declarations are ticked, you will then have a continue button at the end that will then allow you to continue with your examination. Right, then you click continue. Another note, make sure that your phone is on mute or on silence, because just like you saw with mine right now, I got distracted because it rang. And what did I do? I tried to move it to get it silent. When I did that, that means I interrupted my invigilation. So make sure that your phone is on mute so that you do not then get distracted during the examination and you are not then tempted to touch your phone and interrupt your invigilation. Now that you have landed here, you are now going to be given your instructions. And as you can see, it said that my mobile camera is disconnected. It got disconnected just by me trying to answer the call. So when you get any violation during the examination, all your violations are going to appear here. And how do I then reconnect my phone? I will click here, right? QR code. Rescan the QR code. Once I've rescanned the QR code, then my phone will be reconnected and that message will then disappear. While we are here, what you have options there is we have your calculator, we have your QR codes, if in case it gets disconnected, you have the chat function. With the chat function, this is where you are now able to chat to the invigilator regarding anything, right? So say I want to confirm what time my exam will be. I can say hi, invigilator. What time exam, right? And then I send it to my invigilator will be able to receive this message and they'll be able to respond back to me. So now here, while we're sitting here, you then get your instructions. With the instructions, you're being told how long the examination is, what you need to get to be able to pass, how the different sections are divided, what time it is for the different examinations. Again, we're able to go through the instructions just to make sure that you don't miss anything, right? And then you are landed and start the exam. So when you get to start the exam, examinations are scheduled to start at 9. When you get here before 9, do not click the start the exam. If you do click start the exam, it will tell you that you are still waiting for the exam to be started. And then if you are clicking it after 9, you will go through the examination itself. Say you are landed here and you're going through the instructions and 9 hit and the exam becomes open for you to be able to access it. And a message will pop up that says that your examination is now open. You will click OK and then you will click start the exam. If you attempt to access the exam before 8 a.m. in the morning, you will be put in the waiting lobby, right? So let's go through the times again. If you log in before 8 a.m., you will be put in the waiting lobby until 8. So 8 a.m. So if you try to log into the exam before 8 a.m., you'll be put in the waiting lobby, right? You need to wait until 8 and then you'll be put into here when you can start when you are waiting to start the exam. If you are in here between 8 and 9, when you're waiting at this stage, you can read through the instructions, you can type yourself, and if you get it after 9, you'll be able to click the start button and access the exam. So say I am here and it's after 9 and on the day of the examination and my exam is open, I will then click the start button, which will then take me to the actual examination. where I will now be able to see my patients and then go through everything that I need to do, right? So this is the first part, which is what you need to do as an intern. What I will then now do is give you a quick review of what we as the invigilators are able to see. So a better understanding of what is expected of you on the day of the examination. So this is just so that you have caution of what we have open on the day, right? So remember, when I log in, I am the intern, right? So I'm pretty sure if you're able to see the text that is currently going, and that echo is simply because the invigilator is able to also hear what I am doing. So when the invigilator checks on the current intern that is writing, which is now myself, remember on this tab is me here on the exam, right? And then I'm on this tab to show you how it looks like. So now my invigilator is able to see 3 screens. Remember I said this is my front view from the webcam, right? And then this is the side view from my cell phone. They are able to see my workstation, they're able to see my pen, my notepad, and they are able to see everything else that I am doing. That's the second screen. And then the third screen is they are able to see my workstation. So now what they are able to see is what I am doing on the laptop because my screen is shared, right? Remember I said that means that they're able to see. So you can see from the screen share already, they can see that I have my Proctor tab open, and they can see the second tab here at the corner, which is the examination. So if I were to open, for example, another tab, let's open another tab, and then we go to say YouTube for whatever reason. As long as I am on this tab, they will then be able to see. So as you can see, they were able to see that I was on YouTube briefly, right? And then when I close my YouTube, then you can see that also on the screen, the YouTube disappears. So you are allowed to go to different tabs. However, you must know that it will tell you that your focus has changed to a different window. This is fine if what you are doing is allowed because you are aware that they are able to see what you're doing. However, this is also to notify your invigilator to say the intern is no longer on the exam page, they are looking at something else. Please go and have a look at what they are looking at to decide if it's something that they can look at or it's something that they shouldn't be looking at. Right? So this is just how the examination is going to be on the day and how you are going to be invigilated. We'll now go back to the session for you to have any question that you might have answered. Thank you.
Okay, thank you. So with every exam, there is a survey that will need to be completed. So once you have submitted all the answers, or if for any reason it's end of exam and you're still not done, you will still be directed to the survey page where you'll just complete the survey before ending the examination. What's important is before you write the exam, as I said, you need to prepare your equipment. So for your computer, you need to adjust the time zone. So the time zone for you to be able to write this examination, it has to be Pretoria, Harare. The reason for that is that our time zone is what we will use then for your time. So if for any reason you have another time zone, which is an hour ahead, so instead of getting 3 hours, it will show 2 hours because the time zone is different. So it's always important that you adjust your time zone so you can either reduce your time, increase, or not allow you to write it all. So you adjust the time zone before the exam. Also, proctoring, as mentioned, is important. So if you do not connect your phone or you disconnect your phone during the examination, then you might get this message. Also, if you are to start the exam before time, you'll always get the error message that the examination hasn't started. But once it starts, then you will get this message so that you can start the examination. This has been covered with the examination. We have one question per page. You cannot select which question you want to start with because all the questions are randomized. So even if you're sitting next to me, we will not see the same questions, even if we move at the same time. So all questions are randomized, and it's a timed examination. You are unable to revisit any question that you have already answered, but you can always go back to those questions that you haven't answered as yet. There's always the single best answer. This has been covered, and that is important. So you have to always read the questions properly. This is again is important in terms of violation because should you violate any of the rules of the examination, you will get a warning, but you can also be removed from the examination. Google is allowed for you to access the approved online reference material, but you cannot use Google as your reference material. So if you are accessing SAPRA documents, it's all good, or SAPC document, but once you go to Google and ask Google a question, then it becomes a violation. You cannot discuss the paper with anyone. So if there is any background noise, you will get a query or question or a warning from your invigilator. Or if you switch focus of your window, the invigilator will check what you're looking at, then can always give you a warning. If your mobile camera is not connected, you'll also be notified of that, or if you try or attempt to use a second screen. What we have realized in the past few exams is that people have WhatsApp groups where they share answers. That is a violation, and for that you will you'll be violating the rules, and you can be taken to professional conduct. So it is very important to note exam rules apply even though you're writing from place of residence or your workplace. Frequently asked question, I'm just going to run through because I think we have run out of time. So in terms of getting help during the examination, we have the Proctor chat function, which is on the platform as shown before. You can also send a message on the WhatsApp group, which you will have access to on the instruction. It's important that you give time to for the invigilator to respond to you, because sometimes you might have the same challenges as other candidates, so you'll not get a response immediately. And what if the invigilator needs to contact you, as I mentioned in the beginning, make sure that all your email and cell phone number, they're updated, because we will contact you on your cell phone. So just make sure that your cell phone, even though it is on silent, but it is fully charged and accessible for the invigilator to get hold of you. Should you have a load shedding or loss of electricity during the examination, if this happens and you didn't check your load shedding schedule or it's sudden, you have to communicate with your invigilator, but always make sure that your laptop is fully charged and you have an alternative connection should your Wi-Fi get disconnected. And what happens if you lose the connection while you're writing? All the answers that have been submitted are automatically saved. So even if you are disconnected, you will not lose any of your work. The only the time is you reconnect, then you'll have access to those questions that you haven't answered. And that's mentioned, if you lose connection, your mobile phone loses connection, you just rescan the QR code to reconnect. And if you need to change venues before the examination, so for those that are writing in September, if you want to change venues, please send us an email, then we'll just update the venue. And what happens if you are disconnected? Sometimes when you log in the background, the computer might still be hanging onto the page that was open before you lost connection. So you just have to close all the browsers, refresh, and log in again. And where you sit is very important. Like I said, images are taken throughout the examination. So you must ensure that you have sufficient light and, for example, close the curtains and blinds if you're sitting closer to the window. You must test your lighting beforehand. Ensure that the camera is on, dressed up appropriately, because there are pictures and videos taken throughout the examination. And if the invigilator cannot see the images, then they will phone you or to inform you of such. And in terms of the results, if you're writing the practice EISA as it is in September, the results will be released within 48 hours. But those writing in October with a main EISA, the process is a bit longer. It's up to 8 weeks So this is to allow for both QCTO and Pharmacy Council to analyze and verify the results before they are released. So if you feel that you have passed, but then the results say you have failed, you can apply to review your examination. There is an application form to fill in an applicable fee to pay, and you will be allowed to review the questions versus the answer that you have provided, and you also receive the correct answer that was applicable for that specific question. You may ask the facilitator for reference that was used or steps for the calculation, and you can make notes. However, you cannot take any copies or photos of that examination. You may not apply for remark because, like I said, it takes about 8 weeks. The process is verified, so there is no possibility of having an incorrect answer. And I think at the end of the workshop where we can go over the questions, and I'll allow our team members to read the question and provide responses. Natalie, or I'm not sure who's reading the questions.
Thanks, Basiletso. I'm just trying to get to the very first question.
Okay. Are you winning?
Yes, all right.
Okay.
What are the options for learners whose workplace is not an SAPC accredited training facility, and how can they meet the practical training requirements for EISA?
Okay, so I think this was asked before we covered. So there's three categories that can write EISA. So if you're qualified post-basic under the legacy qualification, you don't need to be working under a pharmacist or under a tutor, sorry. You might be working under a pharmacist, but it doesn't necessarily mean that the facility or the tutor must be approved. So that will not be the case. But in the case of a learner, post-basic under the occupational certificate, the requirement is that when they are doing the work-based learning, they work under a pharmacist or a preceptor, as it's commonly known. That will be made, the arrangements are made by the provider. So I don't think that will be an issue. Thank you.
I did my course through Pharmacy Council. That course used to be NQF level 5. Do I still need to write the EISA to get access to tech?
I think I did respond to that on the chat. So the legacy course was NQF level 4, not 5. So if the person is currently registered as a learner post basic under the occupational certificate, EISA is mandatory.
As qualified post-basic, do I have to enroll in this program to become pharmacy technician?
Yes, but this is a personal decision. So for those that do not have any intentions to register as learner pharmacy technician, you do not have to write the EISA. So this is only for those that intend to register as soon as the provider is available for learner PT.
Will I be upgraded as a pharmacy technician by successfully completing the EISA exam, currently a qualified pharmacist assistant post-basic?
No, so writing the EISA gives you access to be able to register for learner PT. It doesn't give you the scope of a PT.
Will a recording of this workshop be available on YouTube following its conclusion today? Yes, it will. It will also be available on the website. Is the EISA compulsory for qualified post-basics?
Yes, only those that intend to register for learner pharmacy technician. Anyone that's comfortable in their role as qualified post-basic do not need to write either the practice or the EISA itself.
I would like to know, can we download practice exam papers?
Yes, we do have practice exam questions on the website. However, you cannot use those during the exam. So you can use that to practice and get yourself ready for the exam. But on the day of the exam, you shouldn't have those as reference.
Do you have to pay for EISA?
Practice EISA is free. Actual EISA, there is a fee payable.
I'm a post-basic since 2006. Write an EISA for access to the Learner Pharmacy Technician course, then do the course, then write another EISA for the Pharmacy Technician, and then be NQF 6.
So you write the EISA to access registration. Once you have completed the PT and the new qualification, then you write the EISA then to get the qualification. Thank you.
Are there any learning materials we can study before writing?
Yes, maybe I can just so if you are on the SAPC website, I'm just going to show this. On SAPC website, you go to registered persons and then you select learner, student, trainee, and then go under assessment. So all the necessary documents are available on this page. So if you want to look at slides from previous workshops, and the current one will be saved on here. If you want to look at past papers, so just be careful that you're looking in the correct column because this first one is basic. So under basic, post basic, you'll be able to get the workshop slides. You'll also be able to get past papers as well as the model answers. In addition, you can access the manual for EISA for post-basic is here, and you'll also be able to see the dates for the current year. So in 2026 for post-basic, we had EISA in April, now we'll have in October. The practice EISA was in March, now it's in September. Thanks, Nick.
I just need more clarity on the transition from NQF level 4 to 5. More importantly, I need information on the prior learning process.
So transition is not NQF level 4 to 5. It's NQF level 4, right EISA, access registration as a learner PT. Then once qualified, you are NQF level 6.
Please advise where to get resources and the names of the resources.
This, I think it was covered earlier. So it's our website is SAPRA website, and I think Dr. Fogati also covered. So just going back to the presentation, but in terms of the model answers or any other document related to EISA, it is on our website.
Can you please tell us who are the providers of the pharmacy technician and is it part-time or full-time since most qualified post-basics are working full-time?
Currently, we do not have the provider for PT, but we are in communication with those that are interested. Anyone that's interested to see at any point, you just go under registered organization, you go to skills development providers, and then under accreditation of provider, you can see who's accredited for what. So by the time there is a provider for PT, it will be registered here. So currently we have only these providers for post-basic, but then if they are interested to have PT, it will be on here.
Is the technician course compulsory?
No, it is not. It's only for those that are interested, and those will be the ones to write the EISA.
Do we need to resign from work and do the training full-time?
No, you do not. It's a part qualification. So no, you do not. And you don't need to be in a pharmacy under a tutor for the occupational certificate.
Is it in-service training?
No, it's not in-service training, but there's a component of work-based learning, but that is arranged by the provider.
I'm not sure if I'm registered to write. There is a letter on my SAPC profile, but I did not receive any SMS.
Yeah, you will not receive the SMS. So once you have booked for an examination under your profile, there is a tab called letters and certificate. So if you have a booking letter, it means you are booked to write.
Where can we enroll as a learner technician? Can we do it part-time as a locum?
Yeah, I think that has been covered. No providers as yet, but there will be soon, and it is not a full-time course.
Does the EISA upgrade the post-basic certificate from NQF level 4 to NQF level 5 if you currently have the level 4 certificate?
Yeah, it's access to registration as a learner, PT.
Are there any future facilities that will provide the tech course through distance learning, taking into account that practical will probably be needed on site? I will not be able to do this full time.
It's once approved, all will be published on the SABC website.
Please clarify open book exam, which specific resources may be used.
Resources were covered earlier in the presentation, so you can use either physical copies or the website, as mentioned. Thanks.
A private pharmacy that is currently registered as a training facility and training basic and post-basic assistants, would they have to re-register their premises to train pharmacy technicians?
No, you don't need to be working in a facility that is registered or under a tutor for that.
How long is the course if you're already qualified and working for over 10 years?
The course is 18 months for everyone.
Will the current qualified post-basic be phased out?
Yes, so the teach out period is June, if I'm not mistaken. Yeah, it's in next year in 2027, the teach out. So anyone that's registering moving forward will be registered under the new occupational certificate.
Will there be a rate difference for technicians and post-basics when they locum or apply for positions?
I can't answer that from the regulator point of view. This will be the employers. I'm sorry.
Can I use my Android phone to access documents or must the documents be printed?
You can either print or use resources on the computer that you'll be writing on.
Does a qualified post-basic have to enroll for this course or can I remain a qualified post-basic?
Personal choice, you can remain post-basic if you do not intend to become a PT.
Where do you complete the practical exam?
There was a communication shared with all registered, the three categories. You have to log in onto the website to be able to book.
Can it be either all textbooks for calculation or both of the examples shown?
Sorry, Nat, can you repeat that?
Can it be either all of the textbooks for calculations or both of the examples shown?
Sorry, I don't think I understand, Natalie.
I think that they want to know, do they need to use one specific textbook for the calculations or can they use
No,
both of them?
no. So it's dependent on the candidate.
Where can I get access to the pharmaceutical calculation textbook? I have never seen it before.
The provider, we don't have any provider for technician as yet, but once we have one that's approved, it will be published on the screen that I'm showing. And maybe just to correct Natalie, so the QPB, qualified post basic on the legacy, is not being phased out. It's a teach out. So it means then if you want to enroll in the future, then you enroll on the new one. I hope that makes sense.
Just to confirm, during the test, may we skip questions and come back to it afterwards?
Yes. So you will have access to all the questions that you haven't provided any answers to. So if you answer, it means that question will no longer be accessible. So if you want to go back, leave it open and then you can always go back to it.
Will there be an opportunity for pharmacy technicians to then become pharmacists?
No. So remember, pharmacy assistant, basic, post basic, and technician, they fall under pharmacy support personnel. So if you want to now transition to a pharmacy, so it means you have to register with the a university. So there's no I don't know, transition from technician to a pharmacist.
How long is the occupational certificate course?
18 months.
Is it compulsory to do this course so that I will be employed? Most of us are not on post doing this.
No. So if the intention is not to become a PT, you do not need to write EISA or register.
As
And
qualified post basics, do we need to write the EISA again, or we need to wait for the technician workshop?
No, so those who are currently registered as learner post basic under the occupational certificate, for them to get the qualified post basic, they need to write the EISA. But for the qualified post basic right now, if they intend to register as learner PT, then they will have to write the EISA. And Natalie, before maybe we continue with the questions, I just want to highlight. So as mentioned, I think there was a lot of confusion before this workshop. So after the workshop, if you now feel like you don't need to write the practice EISA, please just fill in the form and share your P number so that we can remove you from the list of those that are writing.
I'm a learner post basic finishing the course in April 2027. Must we also write the EISA now or next year when we are qualified post basics?
So for the if it's on the legacy, then you wait until you qualify, then you write them.
Is it compulsory as a post basic to write the exam?
No. Unless if you intend to register as a learner PT.
In order for legacy group to write the EISA, they need to write the practice, then the actual EISA. How do we access the textbooks or where do we get them? What is the amount for the practice and the actual EISA?
EISA is 737 for the early booking and the late booking 1104. Practice EISA is free. Yes, you need to write practice EISA before you can write the EISA.
Will the EISA exam be available every year if I choose not to register now, but maybe in a year or two for learner technician?
Yeah, at the beginning of every year, the dates for the EISA will be published. So that's both the practice and the actual EISA. So for 2026, we publish these dates. So beginning of 2027, we'll do the same.
If I obtained a post-basic certificate at NQF level 4 through S-Base, do I fall under the legacy group? And if so, am I required to write the practice exam before writing the actual exam?
Yes, so the practice EISA is compulsory for those intending to write the EISA. So you can't write the EISA if you didn't write the practice. But again, like I said, if you do not intend to continue with registering for learner PT, you do not need to write the EISA.
If I fail the practice exam, do I get the chance to write the main exam?
Yes, so that's the only difference. So with the practice EISA, you can still access the EISA even if you do not pass.
After the EISA exam, how long does it take to get the results? When is the pharmacy technician intake?
No intake as yet because we do not have an accredited provider. EISA, it's 8 weeks to get the results.
What will the learning path be for a pharmacy technician to be a registered pharmacist? Still the 4-year full-time pharmacy degree to go from NQF 6 to 7?
Yes, there's no transition from PSP to pharmacist, so it means you have to enroll for the full course.
When is the practice exam?
It is 1 to September.
Are we
And the
able to
booking-
change the venue?
So let's, yeah, with the first one, so the bookings for the 1 to September is the 24th of August. Sorry, the next question is?
Are we able to change the venue?
Yes, please send the email. I will share now the email address for all the queries. You can just send the email to this email address. So any queries related to the EISA, you can send the email to this. Don't forget to share your PIN number as well.
Do pharmacists post-basic need to submit CPDs now?
Yes, there's a publication, and this will be good then in preparation for the EISA. There's a publication on the website regarding the CPD entries for PSPs.
So the practice ASA will get you a space to get registered as a learner tech, then the actual ASA will make you a qualified tech if you pass.
No, the practice EISA gets you into EISA.
So what you mean regarding payment, even though we already paid annual fee, we are going to pay 737 Rand to write the exam.
Yes, those intending to write to the EISA will have to pay.
Do we write the practice ASA and then the formal ASA this year, or does the formal ASA only apply once we have completed the technician course?
No, so if you're currently registered as a qualified post-basic, you're going to write the practice EISA, then you can register as a learner PT.
Do we get a certificate for the practice exam?
No, you just get your results.
Does the test expire? We are writing now, but the enrollments for the technician course might only be open in a year's time. Will the results still be valid for then?
Yes, there's no expiration.
Can you use a tablet and smartphone to write instead of a laptop and smartphone?
No, you need a laptop or a desktop computer, then a QR code, a phone with a QR code scanning capability. So to write, you cannot use a tablet or a phone, but you will need one then to connect.
On the 1st or 2nd of September, when we write the exam, what are we going to write at 9 o'clock? Is it calculations or general questions?
As indicated, for the practice, it's a one-day exam for both sections. So you are writing calculations and general section in one day. You'll just have a small break in between the two sections.
Can I use a tablet to access EM guidance or other digital references on the day of the exam?
Now, all the digital references should be accessed on the computer you're using to write.
If you failed the ASA, do you get another chance to do it again?
Practice EISA. If you fail, you do not need to write another one. The requirement is that you would have written a practice EISA, but then if it's a EISA, then yes, you will get a chance. Maximum, I think, by the time you get to the third one, there are requirements, but those are published on the manual.
If not that tech savvy, can someone assist us with the test run so that everything runs smoothly on the exam day?
Yes, if you're writing at the SAPC offices, we will ensure that all the computers needed for the exam are set up before the exam.
What is the advantage of this? Will there be more job opportunities for us in the industry or nothing will change?
Yeah, I can answer that one. Just give you access to the next level. That's all I can say.
Is there a certificate issued after the exam?
For practice EISA, no, but for EISA, yes.
Are we allowed to have our own notes on paper?
Yes.
Does it mean we can register for the pharmacy tech qualification and study with the service provider and there's no tutor requirements?
Yeah, there's no tutor requirement. And for WBL, the arrangements are made by the provider.
When should we pay for the ASA exam?
So for the EISA exam, if you want to load the amount onto your account, you can pay in advance. However, if you're using your card, you can pay on the day you are making a booking.
Sorry. So I won't be able to write the exam if I don't have a laptop.
No, you will not be able to write.
Will I be able to write the main exam if I did not write the practice?
No.
What is the difference between the occupational certificate and the pharmacy technician certificate?
Technician falls under occupational certificate. I think that was covered at the beginning of the. So the occupational certificate is 3, so it's basic, post-basic, and technician.
If the EISA is not completed, what are the implications?
If you're intending to continue as a learner PT, you will not be able to register. But if there are no intentions, then there's nothing.
A clarity seeking question, are we writing both EISAs in 2 days?
No, for practice, it's only 1 day. But for actual EISA that's written in October is 2 days. So it's 6, 7 October. Just display. So for this one, you're either writing on the 1st or 2nd of September. But if it is the actual EISA, then it is 2 days. It's 6 and 7 October.
Where can I obtain all reference books stated in the workshop?
Those mentioned are actually examples. So if you have any other calculation textbook, you can use it. So what was shown today in terms of textbook, they're just examples. So if you need a pharmacology and you have a different one, it's acceptable.
If you fail the exam, will you be allowed to write again and will you have to pay again?
Yes, so for the 6, 7 October exam, if you do not make it and you have already paid the 737, the next time you want to attempt, you'll also have to pay.
Do I need to finish post basic first before registering as a technician?
Yes.
When will the pharmacy technician course be available and which accredited providers? Can you opt to write the EISA at a later stage, maybe in 2027?
Yes, you're more than welcome to wait because at this point we do not have any accredited providers.
I wrote the practice exam in March, but I missed the April exam. Can I write the practice again now in September?
If you choose to, but you should be able to book for the October EISA without writing again.
I qualified in 2002. Do I write the exams in September or October?
So if you want to write the EISA, you have to write in September as well.
Can 2 of us write in a boardroom?
Yes, so and this has happened. So the normal conditions of examination will still apply. So you shouldn't talk to each other. You should not see each other's screen. So if you're writing in the boardroom, obviously your invigilator will tell you what's acceptable or not, but the normal exam conditions apply.
Will the universities accept the pharmacy technician qualification as RPL?
I can't answer that, so you can discuss with the specific university, but remember this is an occupational certificate, but I guess you can discuss with the university directly.
Are we allowed to come with formulas of calculations?
Yes, you're more than welcome in preparation for the exam. You can use whatever notes you have. The only thing you cannot use past papers as reference.
I'm a learner post basic doing my hours workplace. Can I write the EISA now or wait until I'm done with my workplace?
If you're ready, you feel ready, you can write. Because this is the last for 2026.
Can we only book for the formal EISA once the practice has been written, or can we already register?
Now, the bookings for the EISA have not, they'll only open on the 25th of August.
Can I use EM guidance during an exam?
Yes.
Should you be employed to do the pharmacy technician course?
No.
If you fail your practice EISA, will there be an opportunity to redo the practice EISA in order to qualify again?
No, you qualify regardless.
Can we use online calculator for calculations and conversions?
You can use the calculator available on the exam platform.
So do we need to pay for the assessments in September? Can the SAPC send us a letter stating that we have an exam so we can give it to our manager to book a day off?
Yeah, so once you have booked, you will be able to have a booking confirmation letter under your profile. So we don't issue individual letters because that letter is already available on your profile.
As a qualified post-basic, if it happens that I fail the tech course, would I still get to keep my title as a post-basic, or what happens?
Yeah, you do not lose your current registration.
What does it mean it's an occupational certificate? Clarity, please.
I think that was covered at the beginning. So there's change. So we have the legacy course with the lower NQF level. So it's a transition now with an expanded. I think it was covered here.
Okay, that was the last question. The slides and the presentation will be available on the SAPC website, and the recording will also be available on the SAPC channel on YouTube.
Thank you, Natalie. But if there's any additional questions, do not hesitate to make use of the email address provided. We can answer, especially for those that want to cancel their bookings. Thank you, everyone. Enjoy your day. Bye.